This is a historic day, the likes of which we've not really seen in this country in peacetime. And despite the dramatic news, it's been reassuring. We've seen state and federal leaders, Labor and Liberal, work effectively together. That's a good thing, and it certainly reassured the markets for now. And it should reassure the public for now as well. I talked last night about how this virus pandemic was going to change the way we live for a while. Frankly, it's going to be a shocker of a winter. But we'll get through it because we're a hardy and sensible lot. At the worst end of the spectrum is the severe health implications. Yes, we've lost 3 people in Australia already. We'll lose many more. They'll overwhelmingly be people who are elderly or frail at the moment, so we've got to do all we can to protect those people. But a lot of people are going to lose work, lose their jobs. A lot of people are going to lose money on holidays cancelled or through other inconveniences. We're going to miss out on sporting events, on concerts and other events. Our working lives are going to be disrupted. Lord knows how we're going to organise to look after the kids when more schools are closed eventually. But this is it. This is our winter of coronavirus infection. This is what the COVID-19 pandemic will do to us. It is unprecedented. We've never had a pandemic on this scale at a time of such widespread global mobility. And it's so important we don't overreact. It's so important we keep it all in perspective. The disease itself, often described as deadly, well, yes, you could describe the common cold as deadly. For most people, we know it'll be like a mild case of the flu, a severe case for others, and yes, in a bad case, like the flu, it can be fatal, especially for the elderly. But already around the world, 60,000 people have had the virus and fully recovered. Keep that in mind, 60,000 people already. Let's talk about why major events and crowd gathering and travel has been cancelled. It's all about trying to slow the infection so that we don't have a huge spike in cases and overload our health system. That's when people can suffer needlessly, when the system gets overwhelmed and we can't care for patients properly. You might have seen a graph like this one going around. There are a few versions. It just shows that if we get the same number of infections over a short period of time, it will overwhelm the health system, even with the proportionately low number of severe cases. But if we can slow that spread and have the same number of infections over a longer period of time, just maybe we can keep the severe cases to a level that the health system can cope with. That's the plan. That's all. It's about being cautious, safe rather than sorry. Change your lifestyle, stay home if you're sick, avoid crowds. Just do what we can sensibly do to slow the spread of this flu-like virus. On the medical front, calm, order and common sense are vital.